It's an extremely common injury. Your foot rolls the wrong way, or you trip and you sprain your ankle. It can range from really minor to severe. And joining us today is Dr. Matthew Wagoner. He's a podiatrist at the Triad Foot Center and member of the Cone Health Medical Group. Thanks for being in.
Thanks for having me again.
So we've heard that term sprained ankle a lot. What does it technically mean?
So a sprained ankle is when you damage or you injure the ligaments to your ankle. So the most common type of thing that we see is when you sprain your ankle, you roll your ankle inwards and you have an inversion type ankle sprain, and you either stretch out or you tear the ligaments on the outside of your ankle, but it can be the inside, outside, whatever it might be, but there's actual stretching or tearing of those ligaments within your ankle.
And what does it look like after you've done something like this?
So it can be anywhere from mild to severe, so it depends on how bad it is. So at a more mild, you might have a little bit of swelling, some discomfort, some pain when you're walking, and the more severe, it starts to get really swollen. You can have pretty significant bruising to your ankle and into your toes, and be very painful when you walk. You may be able to walk on it directly afterwards, or you may not be able to walk, just again depending on the severity of it.
Okay, so what do you need to do if you roll your ankle like this and it begins to swell?
So the first thing you should be able to do is you should make sure it's the right diagnosis. So when you twist your ankle, you can very commonly break your ankle. You can tear some tendons, some ligaments, some other things other than an ankle sprain. So making sure it's properly diagnosed is key number one. Making sure you probably get an x-ray to make sure there's no broken bone or anything like that. Then when you treat an ankle sprain, you should treat it in a couple phases. I usually start with stage one, where you rest, ice, elevate, get the swelling and the pain down. But I think the paramount thing with an ankle sprain is you actually rehab the ligaments, start some physical therapy, either at home or formal physical therapy, in order to help strengthen and help train those ankle ligaments again, so you don't have any issues again in the future with this.
So you would recommend, if it seems even moderate, to go to the doctor and just get it checked out?
Yeah, you can start with some icing, elevation. If it doesn't go away in a day or two, definitely get it checked out. If you're able to walk on it, most likely it's probably not broken. But if you're unable to put weight on it and stuff, then I would definitely go ahead and seek treatment.
And that rehab is super important, I imagine, to maintain flexibility in your feet?
Yeah, so your ankle ligaments are very important about the stability and how you walk and stuff. So if you don't really rehab and you don't help strengthen these ligaments again, it can lead to some ankle instability long term. So in the acute phase, you do this kind of treatment we just talked about. Rarely surgery is indicated in an acute ankle sprain, but if you have repeated ankle sprains and you have some weakness of your ankle, or you constantly roll your ankle when you walk, then you can have chronic tearing of this, and sometimes that does require surgery later on. So by taking care of it in the short term, will help prevent some of those problems later on down the road.
Good advice, something we've all dealt with
Yes.
probably at some point in our life. We really appreciate it.